Friday, everyone, and welcome back. I did not have an opportunity to post yesterday, so I'm going to post today, and we are continuing on with Carl Rogers on Becoming a Person, a therapist's view of psychotherapy, and we are going to continue with directions in therapy, and starting with the bottom of page 80, the full experiencing of an effectual relationship. And we'll likely go to about the top of 84. There's somewhat of a natural break there. And then the next time we meet, we will finish this section and then start moving over to the liking of oneself. So let's see how this goes, and we'll see how far we get. So here we go, bottom of page 80, the full experiencing of an effectual relationship. One of the elements in therapy of which we have more recently become aware is the extent to which therapy is a learning on the part of the client to accept fully and freely and without fear the positive feelings of another. It is not a phenomenon which clearly occurs in every case. It seems particularly true of our longer cases, but does not occur uniformly in these. Yet, it is such a deep experience that we have begun to question whether it is not a highly significant direction in the therapeutic process, perhaps occurring at an unverbalized level to some degree in all successful cases. Before discussing this phenomenon, let us give some body of citing the experience of Mrs. Oak. The experience struck her rather suddenly between the 29th and 30th interview, and she spends most of the latter interview discussing it. She opens the 30th hour in this way. So I'm going to do a dual role play of playing client and therapist, and we'll do a bit of a pause to the best of my ability between them so that they're able to be distinguished. Client: well, I made a very remarkable discovery. I know I found out that you actually care how things go. And then they both laugh. It gave me the feeling it's sort of, well, maybe I'll let you get in the act sort of thing. It's, again, you see, on an examination sheet, I would have had the correct answer. But it suddenly dawned on me that in the client-counselor kind of thing, you actually care what happens to this thing. And it was a revelation, and not that doesn't describe it. It was the closest I can come to this kind of relaxation, a not letting down, but more of a straightening out without tension, if that means anything. I don't know. Sounds as though it isn't as though this is a new idea, but was a new experience of really feeling that I did care, and if I get the rest of that, sort of a willingness on your part to let me care. Yes. This letting the counselor and his warm interest into her life was undoubtedly one of the deepest features of therapy in this case. In an interview following the conclusion of therapy, she spontaneously mentions this experience being the outstanding one. What does it mean? The phenomenon is certainly not one of transference and countertransference. Some experienced psychologists who had undergone psychoanalysis had the opportunity of observing the development of the relationship in another case than the one cited. They were the first to object to the use of the terms transference and countertransference to describe the phenomena. The gist of their remarks was that it was something which is mutual and appropriate, where transference or countertransference are a phenomenon which are characteristically one way and inappropriate to the realities of the situation. Certainly, one reason why this phenomenon is occurring more frequently in our experience is that as therapists, we have become less afraid of our positive or negative feelings toward the client. As therapy goes on, the therapist's feelings of acceptance and respect for the client tends to change to something approaching awe as he sees the valiant and deep struggle of the person to be himself. There is, I think, within the therapist a profound experience of the underlying commonality. should we say brotherhood of man. As a result, he feels toward the client a warm, positive, effectual reaction. This poses a problem for the client who often, as in this case, finds it difficult to accept the positive feeling of another. Yet once accepted, the inevitable reaction on the part of the client is to relax, to let the warmth of liking by another person reduce the tension and fear involved in facing life. But we're getting ahead of our client. Let us examine some of the other aspects of this experience as it occurred to her. In earlier interviews, she had talked of the fact that she did not love humanity. And in some vague and stubborn way, she felt she was right, even though others would regard her as wrong. She mentions this again as she discusses the way this experience has clarified her attitudes toward others. Client. The next thing that occurred to me that I found myself thinking and still thinking is somehow, and I'm not clear why, the same kind of caring that I get when I say, the same kind of a caring that I get when I say I don't love humanity, which has always sort of, I was always convinced of it. So it doesn't. I knew that it was a good thing. See, and I think I clarified it within myself, but it has to do with this situation. I don't know, but I found out. No, I don't love, but I do care terribly. I see. It might be expressed better in saying, I care terribly what happens. But the caring takes form. Its structure is in understanding and not wanting to be taken in or to contribute to those things which I feel are false. And it seems to me that in loving, there is a kind of final factor. If you do that, you've sort of done enough. That's it, sort of? Yeah, it seems to me this other thing, this caring, which isn't a good term. Probably we need something else to describe this kind of thing. To say it's an impersonal thing doesn't mean anything because it isn't impersonal. I feel it's very much part of a whole, but it's something that somehow doesn't stop. It seems to me you could have this feeling of loving humanity, loving people, and at the same time go on contributing to the factors that make people neurotic, make them ill, where what I feel is a resistance to those things. You care enough to want to understand and want to avoid contributing to anything that would make for more neuroticism or more than that aspect in human life. Yes, that's it. Yes, it's something along those lines. Well, again, I have to go back to how I feel about this other thing. I'm not really called upon to give of myself in a sort of auction block. There's nothing final. It sometimes bothered me when I would have to say to myself, I don't love humanity. And yet, I always knew that there was something positive, that I was probably right, and I be all off beam now, but it seems to me that it is somehow tied up in this feeling I have now into how a therapeutic value can carry through. Now, I couldn't tie it up, I couldn't tie it in, but it's as close as I can come to explaining it myself. Shall I say, learning process, the follow-through of my realizations that, yes, you do care, and in a given situation, it's just that simple. And I hadn't been aware of it before. I might have closed this door and walked out, and in discussing therapy, and yes, the counselor must feel thus and so, but I hadn't had the dynamic experience. In this portion, though she is struggling to describe her own feeling, it would seem that what she is saying would be characteristic of the therapist's attitude toward the client as well. His attitude, at its best, is devoid of the quid pro quo aspect of most experiences we call love. It is the simple, outgoing human feeling of one individual for another, a feeling, it seems to me, which is even more basic than sexual or parental feeling. It is a caring enough about a person that you do not wish to interfere with his development, nor to use him for any self-aggrandizing goals of your own. Your satisfaction comes in having set him free to grow in his own fashion. Our client goes on to discuss how hard it has been for her in the past to accept any help or positive feeling from others, and how this attitude is changing. Client, I have a feeling that you have to do it pretty much yourself, but that somehow you ought to be able to do that with other people. She mentions that there have been countless times when she might have accepted personal warmth and kindness from others. I get the feeling that I was just afraid I would be devastated. She returns to talking about counseling itself and her feeling toward it. I mean, there has been this tearing through the thing myself, almost to, I felt it. I tried to verbalize it on occasion, a kind of, at times, almost not wanting you to restate, not wanting you to reflect this thing of mine. Of course, all right, I can say it's resistance. But that doesn't mean a damn thing to me now. I think in relationship to this particular thing, the probably at times, the strongest feeling was, it's mine. It's mine. But I've got to cut it down myself, see? It's an experience that's awfully hard to put down accurately into words, and yet I get a sense of difference here in this relationship from that feeling that this is mine, I've got to do it, I'm doing it, and so on, to somewhat different feeling that I could let you in. Yeah. Now, that's it. Well, sort of, shall we say, volume 2. It's I'm still in the thing alone, but I'm not, see? Yes, that's the paradox that sort of sums it up, doesn't it? Yeah. In all this, there is a feeling. It's still, every aspect of my experience is mine, and that's kind of inevitable and necessary and so on. And yet, that isn't the whole picture either. Somehow it can be shared, or another's interest can come in, and in some ways it is new. Yeah. And it's as though that's how it should be. That's how it has to be. There's a feeling, and this is good. It expresses it, it clarifies it for me. There's a feeling in this caring, as though you were sort of standing back, standing off. And if I want to sort of cut through the thing, it's a slashing of tall weeds that I can do it, and you can, you're not going to be disturbed by having to walk through it too. I don't know. And it doesn't make sense. Except there's a very real sense of rightness about this feeling you have. May it not be that this expert portrays the heart of the process of socialization, to discover that it is not devastating to accept the positive feeling from another, that it does not necessarily end in hurt, that it actually feels good to have another person with you in your struggles to meet life. This may be one of the most profound learnings encountered by the individual, whether in therapy or not. So there's about 2 pages, a page left. I'll just keep going until the end of this section. Something of the newness, the nonverbal level of this experience is described by Mrs. Oak in the closing moments of this 30th interview. Client: I'm experiencing a new type, probably the only worthwhile kind of learning. I know I've often said what I know doesn't help me here. What I meant is, my acquired knowledge doesn't help me, but it seems to me that the learning process has been so dynamic. So much a part of everything. Of me, that I just get that out of it. It's something which, I'm wondering if I'll ever be able to straighten out a sort of acquired knowledge that I have experienced here. In other words, the kind of learning that has gone on here has been something of quite a different sort, quite a different depth, very vital, very real, and quite worthwhile to you in itself. But the question you're asking is, will I ever have clear intellectual picture of what is going on in this somehow deeper kind of learning level? Something like that. Those of you who would apply to therapy the so-called laws of learning derived from the memorization of nonsense syllables would do well to study this excerpt with care. Learning as it takes place in therapy is a total or organismic, frequently nonverbal type of thing, which may or may not follow the same principles as the intellectual learning of trivial material, which has little relevance to the self. This, however, is a digression. Go ahead. Let us conclude this section by rephrasing its essence. It appears possible that one of the characteristics of deep or significant therapy is that the client discovers that it is not devastating to admit fully into his own experience the positive feeling which another, the therapist, holds toward him. Perhaps one of the reasons why this is so difficult is that essentially it involves the feeling that I am worthy of being liked. This we shall consider in the following section. For the present, it may be pointed out that this aspect of therapy is free and full experiencing of an effectual relationship, which may be put in generalized terms as follows. I can permit someone to care about me and can fully accept that caring within myself. This permits me to recognize that I care and care deeply for and about others. So end of reading for today. This was a much longer reading to finish this section, maybe make up a little bit for yesterday, and there was a little bit of cameo from Michael. So thank you all. Have a wonderful rest of your day, and I look forward to reading for you again very soon.